This being, to the best of my knowledge, the first conference which is tackling these issues, and which is not only North Americans speaking to North Americans, but North Americans inviting people who are on the ground implementing this work. So to the best of my knowledge, having done this work for the last 10 years, this is the first conference that's really connecting health outcomes to economic strengthening, and not only academicians talking to academicians, but academicians having funders, program people, implementers, and also academicians with us, okay? So you are all welcome to Chicago. Someone else will be welcoming you to Chicago, but I just wanted to put in that, Rob and Deb, I'm stealing your lines of welcoming people. Then we'll have one breakout session, only one. So everything is going to be here except for one breakout session, which will happen around 11:20. And at that time, session 1 will go in the next, there's a bigger room, next room. That's where we are going to have session 1. And session 2, so the session 1 will talk about orphaned and vulnerable children and adolescents, conceptual issues, and regarding family-centered interventions. So it will go in the next room. E1, is it E1? Okay, E1. Then session 2, working with children in humanitarian emergency situations, will stay here, okay? You get to decide where you want to go. And both of them are great, and the presenters are great, just like the entire conference is going to be great, okay? So that's it. And then after that, we'll come back here, and we'll have a lunch session where we'll have people that we are either already interacting with, collaborating with, or partnering with, and then people we are planning to partner with, people I've worked with, or we have all worked with, present their work from the centers that they are working with, and connecting it also to economic strengthening and health outcomes. We are really interested in the developmental impacts of these economic interventions. And then we will also have a featured speaker, Luz Claver, who really offered to come all the way from South Africa and be able to give us a talk as a featured speaker during the lunch session, okay? And then we'll go on, we'll have financial institutions give their take on our conference and the work we've been doing. And then we will also have, and then we'll have, the wrap-up session will be chaired by John, Lindsay, and Fred wants to be there just to show his smile. Okay. So the program is detailed there, and the bios are behind, so you can really get to know who we have. We have an excellent team. I want to spend, I was supposed to talk up to 9. It was about 15 minutes, but hopefully I can put everything I wanted to talk about today in the next 5, 6, 7 minutes so that we can get back on time. Really, usually what we do, we give acknowledgements at the end, but I don't want to do that because if I do run out of time, Julia, I just want 5 minutes, and 5 minutes, just say, when I'm left with one, say you are left with one. But usually we give acknowledgements at the end, but I don't want to do that because if I run out of time, I want people to know that this would not have been possible without a converted effort of almost each one of you who is here. So this is the team I've worked with for the past 10 years plus on this work. And these are the funders who have funded this work, the research. But there are also people who have funded the conference, okay? So we are extremely grateful. Putting together an international conference is not a joke. So these people have really put in money, put in time, and put in their advice. But they're also individuals in their individual capacity. Unfortunately, Vilma is not with us. She has communicated with each one of you. She's not feeling well, so the doctor has advised her not to fly out of New York to come here. But she sends her regards, and we keep her in our best wishes and prayers. But these are all people who have really worked hard to make sure that this conference happens. And I can't forget my colleagues at the CPC Learning Network. We are partnering with them on this, okay? All right. So why are we here, and why should we be interested in these issues? These are real trends. These are real. I think the biggest number we have had of young people is at this particular time in history, and we have never had this big number of young people. And as if that's not enough, we do have a big number of children who are orphaned. And within that category, we also have a big number of children who are orphaned as a result of HIV/AIDS. And the region that we are focusing on, Sub-Saharan Africa, has almost 8.5 children who have lost one or both parents to HIV and AIDS. These are huge numbers. So the conference is timely. And that's why I really thought that we should definitely come together and talk about where have we been, where are we now, and where should we head. And the steady increase in these numbers has overwhelmed the extended family system. And most of these kids now, when I go to Uganda, I find a lot of young people on the streets. And I always tell people that's very un-African. It's not African. Really, in the past, I grew up as an orphaned child, and I was raised by an uncle. But right now, my uncle cannot even take in any other kids because they are overwhelmed. And this is really should be a concern to all of us, okay? And I don't want to sit here and say everything is, because we are doing this, that everything is well. We have really a crisis. Either you can call it a child crisis, including adolescents. Within that crisis, we have interventions going on, but for quite some time, the interventions have focused on psychosocial ways of addressing the issues that these young people go through. So it's just really of recent, probably in the last 10 years, that we have started really recognizing that, look here, maybe there is something missing in the equation. Maybe we should not simply control for poverty, as statisticians do or researchers do, and just put that control in there, okay? Maybe we need to do something about it, especially knowing that when children grow up in poverty, they're more likely to be poor. And we know that really medical doctors will tell you, even other professions, that poverty impacts mental health functioning. It impacts physical health. It impacts, all kinds of health outcomes. So if that's the case, why should we simply not do anything about it? Why should we control for poverty all the time? And also, actually, business people will tell you that, Fred, the slides you showed us at the beginning, which are talk about the demographic dividend, which talk about the changes in the demographics, are good, because then think about how much market you'd have if all that young population grew up and with a good purchasing power, an effective demand, or how much labor you would have if they all produced. But the issue is, what kinds of young people are we raising if they don't have the skills and if they are not going to be effective purchasing power? Because an economist in the room will say, Fred, don't worry about population. Population, especially young people, it's a good thing. You'll benefit from the demographic dividend. But okay, it's good if it's well catered for and well prepared. So in doing this work, we have partnered. Here what you'll see, we have people from the bank. I call that the market, because really, I never want to think about corporate social responsibility. I always think about the bottom line. They're always interested in, what do I make out of these kids? And then we have the state people here, we have the civil society, we have the family. Because I believe that that's the best way. Thank you, 1 minute. I think that that's the best way to be able to take care of our young people, but society as a whole. That's how we take care of each other. So Fred, what do you think the market can bring to this? Of course, what young people can bring to the market is, if you bank these young people early, if you financially include them, you'll have them for life. How many of us change financial institutions every day? Not many. But also, when a young person comes into a financial institution, that's what I tell Cassio, I tell Sylvia when I'm working with banks, that there is a cross-selling argument, that when a young person comes to you, they are going to bring a relative, if you are well behaved. Of course, if you treat them like they're individuals, they are people, they are going to bring in a brother, a sister, a relative, and that kind of stuff. So there is something to benefit here. I think the case for investing in young people, I don't need to make a big case. For civil society, that's what you do all the time. It's the humanitarian thing, that what is the cost of inaction? If we don't act now, when will we act? And what kind of young people will we be raising? So, in all our work, what we have tried to do is not to dismantle what has been going on. We believe psychosocial interventions are important, but we also believe that there is something missing that we can combine over and above psychosocial interventions. And that's where we have tried to put in economic strengthening interventions. I always want to use the word economic strengthening because I think they are already strong in their way. I mean, they are surviving, but they just need a pulling up, hand up. You need to pull them up. So because, most poor families that I work with, they're already surviving. They're already doing okay. Not doing okay, but they're already struggling and doing the best they can. But the problem is, can we infuse more resources in these households? And if we do that, if we increase the household economic resources, hopefully, this is the pathway to change. Hopefully, we'll see an increased financial stability. Hopefully, most of these young people will engage with education opportunities and health opportunities, and hopefully we'll see better educational outcomes and better health outcomes, which are key human capital indicators. And then probably we'll be able to benefit from. This didn't come out, wow. Hopefully, then we'll be able to benefit from the demographic dividends, that the big demography that I showed you and the demographic dividend. Over the years, this is what we have done to tease out that work. I really want to recognize Dr. Susanna Allison here because she was one of my first funders when no one would touch me. And because this is economic strengthening is not the NIH thing that they were doing at least 10 years ago. That's not where they were. And so I remember my very, very first grant was never funded because they said, I won't mention the program office at the time, but said either Fred, what will happen, and Mary may have read some of the comments, Fred, what will happen is either you'll get frustrated. I was a junior faculty at Columbia University trying to get grants, and I wrote an R03. Is it the yes, R03? And they said, this program officer said, Fred, this is not what NIH wants to look at. So either you'll get frustrated and you'll never come back to us, or you'll be the pioneer in this field and you'll take off and all that. And I said, no, I won't give up the idea. There is a strong theory behind it. There is a strong body that I'm really convinced. There is a pathway that I see that this can result into, and I persisted, and Susanna gave me my first R21, and then, so that was the SUVI, that was 2004, so we can as well, so we are celebrating 10 years of doing this work. Then after that, she extended, not extended, but applied for another funding, and R34, which was Subi Makar, which Subi really comes from the word hope among the Baganda. And really, when I went in to do the pilot test, I went in with the word seed, coming, a junior professor going to the rural Uganda, going in with saving for entrepreneurship and education. It's an English word, it's fancy, everyone understands it. But when I went to the field and we were collecting data, young people and their parents said what the project was doing to them was creating hope in their life, hope in their life, hope in their life. And then they didn't say you were a researcher, they said you're bringing hope. So that's why we came up with the word Subi, because it really means hope among the Baganda, and that's how the Subi family has come into existence. And then, following that, we're lucky to get a big R01 from NICHD, and that's in its third year now. We are now working in 48 schools, and when we say 48 schools, those are the schools that we randomly assigned to the study condition. But remember, these kids, again, eventually go to other schools. So we work in over probably 100 plus schools now. And then we are also able to get another, probably one of the first studies, which connects economic strengthening to adherence to medication. Although there is ART now, unfortunately, most young people, are not adhering to medication simply because either they are poor, they can't afford the food, which has to go with that medication, or they cannot be able to meet the transport cost to go to the clinic. So providing it free doesn't mean they are going to get it. So the issue has been, what can we do about that? So those are the studies that really we are involved in, these two. This is in its second year now in Uganda, in 40 clinics. And it's very exciting. I have my co-investigators here, Mary, Claude, And so we're excited about that. So I'm not going to go. I've already been told to conclude, and I think I'm going to do that. But I'm not going to do well. I'm not going to go through the findings, because then there is Leila Karimuli is going to go through the findings in detail, and Julia will also go through the findings, but I really wanted to introduce you to this work and how we have done. I want to acknowledge these few studies, at least in less than a minute, because really some of these studies I've learned from the work that we did at the beginning. Okay, the Youth Save cites our work extensively, and this is work where I'm the PI in Kenya, where we are recruiting over 70,000 young people and financially including them, and we are following them over a period of time. And the Nigerian study, we have someone from Nigeria who is going to talk about that, and I was invited by the World Bank and New America Foundation, based on the work we had done in Subi, to be able to do work in Bielsa. So, and then the impact study in Kenya that has been recently funded. And so we are extremely excited about the trajectory of this work. And hopefully we'll be able to see what works, what doesn't work. And maybe this is all not necessary. But so you are all welcome. And I'll stop there. I think I'll stop at this map, saying that we started there. And really, we have really spread in different parts, okay? So that's where I'll end. Thank you very much. And so I'm going to invite both Rob and Deborah, who will be welcoming you to Chicago and telling you more about what SSA does before they invite the dean to talk to you and welcome you to his school, okay? Thank you so much. The map? Okay, I'll put it at the map. Okay, good. I leave the map.
Good morning. So my name is Rob Chaskin. I'm on the faculty here at SSA, and I'm Deputy Dean for Strategic Initiatives. My wife says if you're ever offered a job with the title Strategic Initiatives in the title, take it, because nobody knows what you're talking about, and you can sort of do whatever you want. Anyway, the focus of my work as Deputy Dean and is to try to advance and enhance our SSA's work and engagement internationally. And it's a great pleasure, really, to welcome all of you here and to see so many people working in so many places and living in so many places on such critical issues, both research issues that will have an impact on real-world problems around the world. I was asked to introduce a little bit what we're doing on this international front, so I'm going to do that so very briefly, and maybe in the interim we can talk more informally. But basically, we've been working quite hard to think more broadly about social welfare problems, policies, and solutions globally, and to sort of infuse the intellectual life of the school with an orientation toward a recognition of the importance of global processes and how they impact social welfare problems and solutions on the ground here in the US and across the world, and what we can learn cross-nationally by thinking comparatively. So our work on this front really focuses on sort of two broad areas. One is curricular, and the other is on research. On the curricular front, we've been expanding our curriculum and our coursework to include more content that focuses on both global processes and cross-national comparative research on particular sets of social problems and social work responses. And this is infused in the curriculum, so we hope that every student will have some access to thinking about the work they do wherever they do it with a global perspective. We've also been developing a set of study abroad and internship opportunities for students over the course of their master's work. And we've developed a program of study, which is an opportunity for students who are particularly interested in specializing in international social welfare, working abroad, or working with refugee and immigrant populations in the United States to focus their education and educational experiences here on those issues. And then, maybe not finally, but it's the last thing I'll say, we have, as part of our graduate program in Health Administration Studies, GFAP, a global certificate program, or a certificate program on global health. This is an interdisciplinary program, so students from SSA, from public policy, from the medical school, from the business school and from the law school may all participate in this and think, again, cross-disciplinarily about global health problems. So that's on the curricular side. On the scholarship side, in addition to the work that it won't take me even close to 3 minutes. Thank you. Thank you for the warning, though. In addition to the individual work that various faculty members are doing in other parts of the world, and you'll hear a little bit about that from at least 2 of our faculty over the course of the day, we've been thinking institutionally about how to strengthen our relationships and build a kind of infrastructure to help support cross-national and comparative collaboration and research. A lot of that's been focused on scholarly exchanges, so bringing speakers in, hosting colloquia. It's in that context, this conference, which, as Fred noted, is quite unique and on such a critical issue, is very gratifying to see. We've also organized a set of symposia, 3 in particular over the past couple of years, one in Beijing, one in Seoul, and a smaller one in Mumbai, to bring scholars together from those 3 countries in the United States, thinking largely about issues of globalization and urbanization and its impacts on particularly the urban poor. And the most recent outcome of our last symposium workshop in Seoul is going to be the work toward an edited volume that tries to look at issues of globalization and social exclusion as it's playing out in these 4 contexts, and both state and community responses to those issues across a number of dimensions. And each of the chapters in this book is meant to be co-authored by scholars from 2 or more of these states, so we can begin to think cross-nationally and comparatively about these issues. And we hope that this is going to provide, all of these activities, we hope will provide a kind of foundation for future research collaboration and institutional relationships. So it's in that context that, again, this event is quite a spectacular thing to see, and we hope that over the course of today, and for those of you who are sticking around tomorrow, it will also provide or continue to provide a kind of foundation for future work together. So welcome and thank you.
Good morning. I'm Deborah Gorman-Smith, and unlike Rob, I actually need some notes because I'm getting older and I forget things a lot. But I want to just take a few minutes to welcome all of you to Chicago and to SSA. We're so pleased to have this group of distinguished scholars here to meet about such an important area of research and practice. And we hope that for those of you who are not from Chicago, that you have some time to explore this great city that you're in while you're here. During the day while we're meeting, we like to have it a little bit cloudy outside so that it's not too sunny in here. But the sun will come out when you go outside later on, and you'll be able to have a chance to enjoy that. So SSA is a really unique place made up of a multidisciplinary group of faculty. People who are working here are trained in social work, psychology, sociology, anthropology, political science, urban studies, economics, public policy, and I probably haven't even captured all of the disciplines that are represented in the faculty here. But we all are conducting research to address what we think are some of the most pressing questions in clinical social work, social policy, social welfare administration, and community development. And importantly, we're working to use this research to inform practice and policy in order to make a difference in the lives of children and families and communities. There's a breadth of substantive interest among the faculty working here, including a focus on health policy and politics, poverty and inequality, education, low-wage employment, urban labor markets, family stability, mental health services, community organizing and development, as well as research focused more squarely on children and youth, including basic developmental research focused on children and youth in the child welfare system, immigrant and minority youth, the impact of exposure to community violence, risk for substance use, HIV and violence, and all also people focused on intervention and prevention research. Fred had asked me to talk about the research that's going on here at SSA, and that would take us a couple of days to do. So, but I think that just gives you a sense of the depth and the breadth of the work going on. And I just also want to take a minute to say how impressed I am with how quickly Fred has worked to integrate many of our faculty into this meeting, faculty that are really working across diverse areas, and he was able to see connections that maybe some of us weren't already able to see. And so it's one of the reasons that I'm so incredibly excited that Fred is here. I'm really excited to be spending the next couple of days talking about these really important issues. So now it's my distinct pleasure to introduce the Dean of SSA, Dr. Neil Guterman. Dr. Guterman is the Dean of SSA and also the Mose and Sylvia Firestone Professor. In addition to serving as dean, he's one of the nation's leading experts on child abuse and neglect and children's exposure to violence more broadly. The primary focus of Dr. Guterman's work has been on advancing services to prevent children's victimization before it occurs. He served as the principal investigator for numerous federally and privately funded research studies. He's the director of the Beatrice Cummings Mayer Program and Violence Prevention here at SSA. He's advised the Surgeon General's Office, the Centers for Disease Control and Prevention, the International Society for Prevention of Child Abuse and Neglect, Prevent Child Abuse America, and the National Conference of State Legislators about issues related to child abuse and neglect. Please join me in welcoming Dr. Guterman.
Good morning, Deborah. Thank you, Deborah, and good morning, everyone. Welcome to SSA, welcome to Chicago, and welcome to the University of Chicago. I know that many of you are coming from a variety of locations, not just locally, and I would just echo Deborah's urging you to take a little bit of time to, if you have the time, to see the city of Chicago, to see the University of Chicago, and you'll get a little bit of a flavor for SSA during the brief period that you're here. As Dean, if you don't mind, I'll take a little bit of deanly privilege to give you just a drop of history about the School of Social Service Administration. For those of you that don't know us well, we are one of the founding schools of social work in the United States and helped to develop the profession of social work here in the United States. And we really started actually down the street at an organization many of you have heard of called Hull House. Many of the women of Hull House, one of whom then later became our first dean and helped to found this school. Essentially what they were doing was they were serving the waves of immigrants that were coming to America from countries abroad. And helping them survive and make it in this country, and dealing with individuals who were deeply poor, who didn't understand the culture, didn't have access to resources to the society at large, and so forth. But what Edith Abbott, who was our first dean, did is she basically said, yes, it's important to serve, but we have to do such with science, we have to do such with rigor, we have to do such with evidence. Otherwise, we don't exactly know whether what we're doing is helpful, we don't know where to deploy our energies, and so forth. So I would say that was over a century ago, and I would say that legacy carries forward even to today. The School of Social Service Administration continues to be at the forefront of advancing the the science and the intellectual rigor and the analysis so that our policies, our programs, our practices, our strategies, and so forth really optimally serve those in greatest need. And so that's carried that sort of blueprint or imprint since our inception over a century ago has very strongly been part of our mission and continues to be going forward. The other element, though, I would say is that the profession of social work in the United States, at least, has tended to be very focused on our own neighborhoods, our own backyard, if you will, to talk colloquially. That is, we see needs in the streets, in our communities, in our neighborhoods, in our schools, our hospitals, and so forth, and we meet them, we rush to them, and we help out. And we haven't historically focused so much beyond that, although, again, at our inception at Hull House, our first social workers were really dealing with those who are coming from other cultures, other nations, other struggles. And so since its inception, SSA has only sort of incipiently dealt with global issues. And it's only just in the last couple of years that the profession of social work, and I think that SSA is now taking up some leadership, as evidenced by this conference, by our new faculty members, Fred and Layla and others, and to begin to understand that many of our deepest concerns that we as a profession have been dealing with for quite some time, HIV, as Fred mentioned, poverty, human trafficking, substance use issues, many of those problems that Deb Gorman-Smith just outlined, many of those problems, in fact, have global manifestations, for sure, global drivers, and global consequences. And so for us to understand and to be most helpful, we have to think much more broadly, and we have to redefine what we think of as our neighborhood. Putting it shortly or succinctly, the world's a much smaller place, and we're now recognizing that. And so SSA, I think, is very proud that we are now beginning in a very unmistakable way to begin to take on such concerns in a much more global, internationally connected way, recognizing all those realities. I would also say that we are playing an important role at the University of Chicago. I hope that some of you will have a chance to get a feel for the university, at least our grounds and so forth. But the university itself has now moved, just in the last few years, in a far more globally engaged way. So just last month, actually, Rob, you were at the opening of the university's new center in Delhi, in India, which was it has attracted a great deal of energy and excitement, and so we'll be beginning interactions in India, or growing those interactions, I should say. Also, just a few years back, the university opened a center in Beijing. We have a center in Paris. We have a center that's just opening up soon in Hong Kong. And there's growing interest in the global South and in Sub-Saharan Africa. And so I'm especially delighted at the conference today because I think this is a very visible representation of where we are going. Well, we have a long way to go, but where we're beginning to move. And so we therefore welcome your engagement, your partnership. We welcome working and collaborating with you because we see that there's an enormous amount of work to do. We believe that there's a great deal we can contribute. And we welcome your partnership. I want to wish you a very successful conference. I hope you enjoy your time here, and thank you very much.